So the biggest obstacles to treating female sexual dysfunction as an OBGYN or primary care physician are really the socio-cultural barriers of communication. Over 80% of women do not bring up sexual dysfunction at their visits. Over 80% of physicians do not ask. So there is a little bit of a don't ask, don't tell problem. Women are, to use a cliched term, suffering in silence. They're not talking about it. They often feel it's just them. There's something wrong with them. They're broken. They may not be talking about it with their friends. They may not feel comfortable broaching it with a clinician. So the biggest obstacles are really both the patients themselves and the physicians who, whether they're uncomfortable discussing sex or they're not sure the answers they would give if a patient said, I have a sexual problem, or they feel uncomfortable because of perhaps the patient's gender with respect to their gender. These are the biggest problems. Time is sometimes an issue. Patients will cite that the doctor felt rushed and it was all the doctor could do to ask me about heart disease or menstrual issues. Doctors cite time as a big issue, but I find the main reason it's not discussed is the clinician's not comfortable discussing it and the patient's not comfortable asking. Symptoms that are most associated with sexual dysfunction are pain. Pain with intercourse, pelvic pain. Women who suffer from pelvic pain conditions, whether they're undiagnosed or diagnosed endometriosis, fibroids, pelvic floor muscle dysfunction, these comorbidities tend to result in pain with intercourse. Other comorbidities really are more behavioral health related, depression, lack of self-esteem, things like this, marital problems. These can lead to female sexual dysfunction with perfectly normal anatomy and physiology.